Welcome to the WMed Specialty Spotlight Podcast, your virtual mentor for choosing a medical specialty and planning a career in medicine. On this podcast, we probe practicing physicians with questions about their specialty, the decision algorithm that helped them determine that the specialty was right for them, and then for advice about long-term career planning, irrespective of the field they went into. I'm your host, Dr. Biren Shah, learning with you all about the various specialties in medicine. Just a quick reminder that the show notes for this episode and all episodes can be found on our website at wmed.edu/specialty spotlight. If you'd like to help support this podcast by sponsoring an episode or a physician willing to volunteer for an interview to talk about your specialty, please email the career development team at career.development@wmed.edu. The specialty of today's show is pediatrics, and the physician here to tell us all about it is Dr. Priscilla Woodhams. Dr. Woodhams grew up in the Kalamazoo area. After graduating from Michigan State University with a degree in education, Dr. Woodhams taught elementary school and assisted with educational research for 2 years through Michigan State University. She then attended the University of Michigan Medical School, where she also completed her pediatric residency. After finishing residency, she worked in a migrant farm workers clinic in the Yakima Nation, a Native American reservation in Washington State. Next, she became the faculty for the University of Michigan, where she worked in both the inpatient and outpatient settings and was the faculty lead for Health in Action Global Reach, where she led teams of medical students in rural Dominican Republic and Quito, Ecuador. She moved to Atlanta, Georgia, where she continued to work in both the outpatient and inpatient settings and supervised University of Michigan medical students in the HIA Global Reach program, as well as teach medical students from the Medical College of Georgia, Emory, and Morehouse Medical School. Dr. Woodhams holds a strong belief in health equity and was the only pediatrician in the county she worked in Georgia that always kept her practice open to patients on Medicaid. She also volunteered to work with Cor Rare Timoon, an internationally recognized organization that helps to improve healthcare in rural Haiti after an earthquake devastated the country. To be closer to her parents, as her mother had some health concerns, she moved back to Kalamazoo and became faculty for WMed in 2016. At WMed, she helped students establish the Global and Public Health Medical Student Interest Group, created the first medical student distinction in global and public health, along with several electives in global health. She received a certificate in global health care delivery from Harvard Medical School in 2020. She continues to see patients, teach residents, is a pediatric clerkship director, and runs several medical student electives, and heads 2 medical student interest groups that focus on global health and health equity. She has received many teaching and patient care awards. So without further ado, Dr. Priscilla Woodhams. Dr. Woodhams, welcome to the show.
Thank you. It's good to be here.
Well, I'm excited to have you here for you to share with my listeners about the field of pediatrics because it's a specialty that many students are interested in. So you heard me read your bio. Was there anything that you'd like to add?
No, I think that sounds pretty good. That sounds it up. Thank you for asking, though.
Okay.
It's funny listening to it all in one spiel. I'll say that.
Well, would you be able to take us back to the time before medical school and kind of walk us through your decision to go to medical school in the first place?
Yeah, I'd be happy to. I was, I always had an idea in my head that whatever I went into, I wanted to focus on some way of working with people where it was communicating to help make their life better in some way. So I went into education first. I thought about medicine very, very seriously, but I knew medicine really well. My father was a family practice physician, and I worked in a family practice office since I was 15 years old. And I was worried about my ability to be calm and not fall apart when people were significantly ill. I just thought, I knew that was part of the job, and I worried that I couldn't do that. It's kind of an irony thinking back what direction I ended up taking, going to Haiti after an earthquake. But I was worried about that. And then my grandmother had a severe stroke. And I visited her, and we just all decided we wanted to spend a night in the hospital with her because she couldn't communicate after the stroke, just for some comfort while she was there. And I don't know, I guess that did it. I was young, and I realized, I can hang out in this hospital with my grandma. I really like these people who are seeing her as a person. And so I lost my fear of working with people who really had like significant things going on. I didn't fall apart. And then the second thing that happened was that I love, adore working with children, obviously. Okay. But I miss talking to adults. I have to be honest. When you're an elementary school teacher, you go the entire day talking to kids, and I adore them. I went into pediatrics, but I really miss that interaction with adults. And I realized that when I was teaching elementary school, I really loved focusing on the kids who had significant stuff going on and working with their parents. And so that was how I made the switch. I think it was twofold, realizing I love that like individual interaction and working on a problem. I sort of felt overwhelmed with 28 kids and felt like I don't know how to address all this stuff. And so I went into medicine, and I'm really happy with the choice. So that's how that happened.
Great. Thank you for sharing that. I think this is a great opportunity to transition to the first part of the interview, where I basically ask you to tell us everything there is about pediatrics. And the way I like to start off this section is by reading you a description of your field from the Association of American Medical Colleges Careers in Medicine website. And then I'll ask you what you think about it, and we'll take it from there. So here it goes. Pediatrics. Pediatricians practice the specialty of medical science concerned with the physical, emotional, and social health of children from birth to young adult. Pediatric care encompasses a broad spectrum of health services ranging from preventative health care to the diagnosis and treatment of acute and chronic diseases. Pediatricians understand the many factors that affect the growth and development of children. They understand that children are not simply small adults. Children change rapidly, and they must be approached with an appreciation of their stage of physical and mental development. How much of that do you agree with, and what would you add or subtract to ensure that anyone listening was well informed about the practice of pediatrics?
Yeah, I think that what you will hear pretty much when any medical student talks about pediatrics, I'm just going to say what I hear from the students. They're like, I love the kids. The parents can be a challenge. That's what they say. That's what they usually will say to me. So what I think is everything you just said is true. However, I think that there is a unique dynamic to pediatrics because until you get, we see patients up to young adulthood. So some of our patients are, of the legal adult age. But for all of those under the legal adult space, we are actually working with a team, the parents or the caregivers of that child, to have something happen. So I think what I would add to that, I would have to think of the proper words, but just something to capture the essence of that you're a healthcare team for a child. And then also something about how children are so, they can't vote, there's a lot of stuff they can't do for themselves. And so you really do have to be an advocate and keep in mind that your job is to care for that patient. And it is quite it's a skill that you develop over time. And I think it's what drew me to pediatrics also is that way of really understanding the caregivers, parents or whoever it is, and really listening to them and trying to find a way to communicate with them so that they will then decide to do some care plan for their child that's in their child's best interest. And I think that's missing from the dad. They're just talking about the kids, but it's hard to help the kids without that team, which is whoever it is who's surrounding the child. So I think that would be a piece I would add. And I would also add, it's imperative to have a strong interest in advocacy, because children do not have a voice unless we give them one. It's just the way it is in our society. So,
no, great. Thank you for that. And I kind of want to actually touch upon some of the things that you mentioned. And these are kind of more specific to PEDS, because I normally, the questions I typically ask are really broad spectrum to all specialties. But, it's often said the toughest part of treating kids is treating the parents. And it's often cited as a reason why students do not go into pediatrics. What are your thoughts on this?
I think that when you have the opportunity to work with children, what I think, instead of thinking as the parents as the problem, take joy in really the challenge of, some parents and caregivers, it's so easy, and some it's a challenge because they're really coming at things from a different angle than we might be with our view of evidence-based medicine. But I think thinking of the challenge of providing excellent care, part of that comes with the challenge of working really hard to understand your families well and communicate with them well. And what I have found, and I've been doing this job for over 25 years, working with parents for longer than that, is that you really can find something with every single caregiver that you interact with that you can connect with. Like I mean, there's a few examples obviously with like child abuse, but barring that, you can really think of it not as something negative when someone has a different attitude towards you and how they approach medicine. Think of it as just part of your work, and think of it as like a challenge, like you would if you had a complex physiologic case come in. Like, how can I work with this person to help them see that whatever it is that their child needs is what their child needs? So I guess approaching it as a interesting part of your work will probably help with that. That's what I would say.
That's a great answer, and thank you for that. And how tough is it to work with human beings that can't always express themselves?
I love it. My job is not tough in the sense that when you love your work, it doesn't make it tough. What will I say is it's different. And I love, something that keeps me on my toes with my work. And so walking in and seeing a 9-month-old, there's stuff that boom, boom, boom goes through my head, even though they can't talk. They communicate. Actually, sometimes I think some of the children who aren't using words yet may be easier to interpret how they're feeling than some of the ones that do, because, as you get older, people tend to hide how they feel. A baby, they're going to let you know if they're upset or mad or whatever. And sometimes as people get older, they hide it a little bit more. So I think it's a challenge, but I think it's a fun challenge, because every patient you approach, you look at them in a different way of communicating. Like, how do I communicate with this person as opposed to this person, and where are they at developmentally? And a lot of times it's not even the age. It's just that, you'll have a child who's older who is non-communicative and really understanding really effective ways to communicate with, say, a child who is nonverbal and has autism. There's so much, I get so much joy, especially when some of the more patients who come in like really irritable, and then, they get to know me, even though they can't even speak, and they get used to me, and I can see they're calm and happy coming in. So I like that part of my job. I think it's fun.
Yeah, no, that's great. Granted, it's tough to see anyone suffer, but is it tougher for you to see kids suffer, and does it take a toll on you?
I think I know with my personality, it is very hard with my personality to be in certain specialties in pediatrics. And I'm incredibly thankful that there are people who can. And the specialties for me personally, everybody's different. But for me, I did an elective in child abuse. Okay. And I loved that elective because I thought it was really helping children in so many ways. But I do know that I, I do know that even to this day, there's like a chemical reaction that goes on when I'm interacting in that way that can get at me a bit more than I think I could handle every day. I don't know, because I only did it for 6 weeks, but I felt like maybe I shouldn't go into that as a specialty. And the second place I felt that way was in the PICU. But again, it's not, I love the medicine in the PICU and I love what you do in the PICU, but it was more just that you can laugh, and this is just my personality. As soon as the patients could talk, they were out of there. I kind of like to talk to people. I know the PICU doctors love to talk to people too. I don't mean that, but I just mean like, is it hard? Yes, but I also want to speak to the fact that I'm one type of pediatrician, and thank goodness there are those people out there who do what I do very easily. So I actually I felt joyful on HEMOC. I mean, yes, it's hard to tell people you have cancer, but there's so much joy in supporting people through really tough times in their life. I'm a primary care doctor, so a lot of what I do is I don't just see people for a small bit. I see them after I've let them know something hard, that will be a challenge for their kiddo. I see them through that, and I take a lot of joy in that. And there's joy in helping people through tough times. And I think that's why we all become physicians. We want to help people. So I think that, is it hard to see kids in that? I think of course. But I also think that different people can see the joy in helping people through challenges. And there are some really tough challenges that kids face. So along with that can come a lot of joy in helping during those tough challenges. I hope what I said made sense.
Yeah. No, that's wonderful. No, thank you. That's great. What, and putting on the hat of a general pediatrician, what does a typical daily or weekly routine look like? And you can change that time frame to whatever is conducive for your answer. And what does a typical series of patients look like? And what is a typical outcome for these patients?
Yeah. So it really depends on where you're working. Okay. So one thing about pediatrics, and especially general pediatrics, is there's a lot of opportunity to fit your job in a way that you feel like you would like to. So for example, when I first graduated from residency, I worked in the Yakima Nation. And I resuscitated. I would get up in the morning, go around on patients in the hospital, go to clinic. I'd start seeing clinic. Sometimes I'd get called in the middle of clinic to go resuscitate a baby who was going to be born either premature or that was a C-section. And I'd have the staff just let the patients know, like, hey, I have to go help someone in the hospital. Then I'd come back, finish up my patients. And then if there was a patient in the hospital, go back, round on them again, and go home. And while I was working in the place on the Yakima Reservation, I was on call 4 days out of the week. I was first line in call. That sounds very exhausting, but I loved that job. And I also would say for those interested in that type of work, know that it's interesting when you really are the only doctor for people. People don't call you for I never got a phone call in the middle of the night, like my baby's been constipated for a week, and then I'll say, how are you? And they're like, they're fine. You know what I mean? Like, you're kind of like my age during the day, but you never say that. I never got any of those kind of calls. The calls that people called me for was like, thank you. I'm so glad, yes, let me help you with this. So I don't know if that was because they realized I was one human while I was doing that. I have no idea. But that I think is one type of job. There's other places where you can work where you go in the morning as a general pediatrician. You don't go to the hospital. You don't round on newborn service, and you see patients in the outpatient setting. And, that can vary depending on the patient load. Sometimes for certain places I worked, it was like jumping off a ship and trying to tread water because the amount of time I got for patients was amazingly short. The patients didn't know it. They always thought I spent enough time with them, but I didn't. That is one way. And then sometimes you work for places where they do give you plenty of time to work with your patients, and you're like, put more on my schedule. I can see more. So I think that is it. And you can, that's for general pediatrics. So, and you'll see people from birth all the way on up until young adulthood. And some are very cute. Like I had one of my patients got married, and then she said, can you help me? I really would like to know how to get pregnant. And I was like, I think it's time for you to see an adult doctor, because I help kids from getting pregnant. It's not my specialty. She was so cute. But, we don't put a cutoff on pediatrics. It really is when the family decides or the patient decides it's time to move on to adult medicine. But it can be all ages during the day. And I mean, some stuff is very routine, but it's like every specialty. Everything gets to be routine in every specialty when you do it a lot. So.
Okay.
Checkups. There's a lot of checkups. I'll say that too. There's a lot of healthy kids you see. You see a lot of kids who are completely fine, and their wonderful parents are just worried. But you got to find, I will say, if you want to be a pediatrician, you have to find joy. And a person coming in totally well-meaning and their child's completely fine, and you help them realize your child is healthy, you're good, and take joy in that. Because if you don't, it'd be a rough life.
Are you able to touch upon some of the subspecialties in pediatrics?
Yeah, they are phenomenal. The thing I think you'll see, well, there's the obvious things like the neonatal ICU, which is pretty obvious what that is, and then the PICU ICU. I think for people thinking about pediatrics, the huge difference in ICU work in pediatrics is the phenomenal resiliency of children. Like, it's a different world than working in an adult ICU as far as it's very hard to predict outcomes to a certain degree, just because it's just hard because kids are so resilient. You can see a lot of kids respond differently to different things. So I think the resiliency and obviously the change in you have to really think carefully when you work in pediatric ICU about the age of the child, because their physiology, as ICU doctor, you got to really pay attention to that physiology. And it changes so much. You always have to have that in your head. Like, how old are these kidneys? Are these premature kidney? Are these a 6-month-old baby's kidneys? Are these teenagers' kidneys? Simple things like that you have to think about. So that's what I would say about ICU work. The other subspecialties, they tend to have a slant towards different, typically different genetic components that happen that, you see more commonly in children. Like pediatric cardiology is this wonderful thought process of, congenital heart defects. And I love thinking through, like, this goes this way, this goes this way, that goes that way. And boy, is peds cardiology full of that. Which is very different than an adult cardiologist. And, I think, if you're a pulmonologist, it's going to be a little different because you're going to have CF. We're making lots of advancements in cystic fibrosis, but I think you would see more things like that as a pulmonologist than you would as a adult physician. So less chronic disease, obviously, across the board, and more focusing usually on congenital stuff. But yeah, it's fun because there's so many different subspecialties in pediatrics that are out there.
Yeah. I mean, when I looked at the Careers in Medicine website, I mean, there's quite a list of subspecialty opportunities within pediatrics. So that's and would you say that in your experience, do most residents that complete a pediatric residency, do they decide to do a subspecialty, or is it kind of a percentage of people that
it's I don't know that I've ever heard of in all the places I've worked, I've never heard of a pediatric residency program that only graduated subspecialists. It's hard, as one knows in medicine, to give up medicine. I mean, that's tough. And so when you decide to go into a subspecialty, you give up a whole lot of pediatrics, which you don't give up when you're in primary care. And so I don't see that happening. The other thing is, I just read a interesting article, I can't remember which journal it was in, but it was talking about what an extreme shortage we have of primary care physicians. And I think the fact that, that's now being really identified in the medical literature, I would doubt that you would see a shift just to subspecialty, but I've never seen that. I think it's just, it's tough, when you go through residency to give up something. And so I think you're always going to see some people going to primary care.
Yeah. What do you think is generally considered the most exciting about pediatrics? And conversely, what is generally considered most mundane about the specialty that physicians tolerate to experience the more exciting aspects of it?
Yeah, the joy is working with the kids. I don't know if anybody would say anything different. There is nothing cooler than seeing a kid be happy or helping them out or a smile on their face or a baby who just, you can tell they're better because they calm down or whatever. It's working with the kids. It's seeing growth and just the humble feeling you get that maybe you played a small part in helping them grow. It's cool. So that I think pretty much every pediatrician is probably going to say to kids. The most mundane part is that depending on, even when you do the ICU work, it's the same thing. Because kids are so resilient, I suppose, I don't do all specialties, but I'm just supposing it probably applies to all specialties. Kids are good about getting better a lot, which is great. But then again, sometimes I think it makes treating children in certain situations less of a challenge because they don't have as many problems going on because the chronic diseases haven't kicked in. So for example, if I have somebody with something basic, asthma, okay, that for me is really easy to treat. But I can picture if I had a patient come in who is an adult, they may have type 2 diabetes, they might have some arthritis going on, and they might have asthma, and they might have a substance use issue that has been going on their whole life that makes it really hard to work on their asthma. Instead of like, if I have a teenager who's doing that, it's only been going on for like, a year or something instead of 20. So I think that because you don't see those chronic diseases in all parts of pediatrics, I think that probably for all of us, there is a little bit less perhaps challenge in what we're doing from a physiologic sense because so many things tend to be resilient in children. Does that make sense?
Yeah. No, it does. It does. I mean, kids are resilient and get better. So I mean that's but yeah, I can see that also being mundane.
You're not inviting someone to the PICU with like 20 years of type 2 diabetes, chronic hypertension, and 3 MIs. That's not who's getting admitted to the PICU. The same thing. When patients come in for their checkups to me, it's not like they have all that. They may have some chronic disease, but they are not going to have what I just said. So I think that is part of the thing that can make pediatrics, like you said, maybe a little more mundane than if you were dealing with people with lots of chronic concerns.
Okay. And thank you for that.
Sure.
What is the biggest challenge facing pediatrics, and where do you predict the specialty will be 10 to 20 years from now?
Today?
Or
Well,
today.
I'm going to say for today, and I think this is probably for all time. When I said in the beginning about how one has to advocate for children, it is not very easy to advocate for children at times. Today, funding was cut off for all kinds of child health programs. So I got an email this morning saying that my friend who works for USAID and is helping set up NICUs and doing some other work, and is just, they flat have to stop. So what do I think? I think that it's incredibly, but nothing was cut off for Medicare. Okay. So, I mean, to me, one of the biggest challenges facing pediatrics is that we have to be voices for children. And because they don't vote, there's a lot of people who just don't think about children the same way. I mean, it's hard. Like, not having senior services cut off is phenomenal. I'm so happy for that. I also think that perhaps school lunches could stay.
Hmm.
But then
Yeah.
again, they don't vote. So I think the biggest challenges facing pediatrics are just our decision as a society to value children, all children equally. And that's actually what the American Academy of Pediatric has, a very simple slogan: dedicated to the health of all children. Very simple, very straightforward, but incredibly challenging if you really go about your life working to make that happen. So that's the biggest challenge. And then you said, where do I see it being in the future? I am an optimist, and I really think that we as humans are, for the most part, out for the greater good. And I think when you can touch on people about kids' health, there's something in almost everybody who's like, you know what? I take it back. I do want to help the kids. So I think, although I say that this morning, I really am an optimist. I think this is going to flip. I think people are going to be like, you know what? Yeah, let's help the kids. And I think that it's just a matter of people realizing that we're all out for that and
Hmm.
deciding to work towards that. So I'm optimistic. I think there's so many challenges in healthcare in general going forward. Like I said, there's challenges with primary care. They don't get equal reimbursement, and also pediatric subspecialties do not. There's many pediatric subspecialists who, although they have additional training, make less than people who have less training than them. So I think, that's a challenge with pediatrics. But one of the things that, it's the good and bad of pediatrics. Our salary, as everybody knows, is not at the top on the list of salaries when you look at them, or whatever, how much we make. Um, that's obviously something we need to keep advocating for. We should be paid equally when we care for children as people who are caring for adults. But on the flip side, pediatricians, because they've made that active decision that they are doing what they love, they end up having very high job satisfaction.
Hmm.
So I
Yeah.
think that that's a negative. But on the flip side, you've already made up your mind. I'm going to have enough money to live. So I think some of that stuff maybe doesn't bother you quite as much because you've already made that decision. I'm just doing what I love.
Yeah. Yeah.
Yeah.
No, that's a great answer. And it's a nice transition to our second part where I kind of would like you to tell us about how you decided that the specialty of pediatrics was right for you. And are you able to kind of share your story as to how you came to decide about going into pediatrics, or maybe aha moment, and if there was any struggle that you had with other specialties that you were contemplating?
Yeah. Um, I had an incredibly hard time making up my mind what I wanted to do as a medical student before I started medical school, because I had had, I don't know, I was what, I'd had like 7 years of experience in primary care, and boy, did I love it. I loved watching that, and I knew what that was about. I mean, it would be hard to not have that much experience working in a primary care office and not understand that. So I do think one of my advice to people is, in any small way you can, even if it was like me, I was doing very mundane stuff. I was like filing and opening mail, and I don't know what it was very mundane. But if you can find a way, if you think you're interested in something, to just get some exposure to it and just look around. And even though what you're doing may not be the job, just think about it really hard. That will help. I knew I wanted to go into primary care when I started medicine because I like working with people in the long term. I just couldn't pick which way to do that. And it was incredibly hard to give up adult medicine. I struggled with that. I love working with people who, of all ages. There was nothing better than having a patient who had so much more life experience than I did, and working with them. I loved it. Um, for me personally, my mind just spun around in circles, and I had so much experience with kids, and I had a degree in education. And I was like, you know what? I'm just picking pediatrics. I'm pretty sure I would have been very happy in, other primary care fields. But what I will say, because I don't know that my experience is um, one that's common. There's a lot of people who have no experience with children, and I want to speak to them for a second. Go into pediatrics with an open mind, because I have seen many people who maybe have never even touched a baby. And when they go into their pediatric rotation, and they are fabulous pediatricians to this day. So keep that in mind. I've had people who are like, I am becoming an adult neurologist, period. And then they do a day of peds neurology, and they're like, oh my gosh, I love this. I'm totally doing peds neurology. And I didn't even know I liked kids. I thought I hated them. That's why I was picking adult medicine. So I guess all I would say is to those people listening who are like, look, I already know I don't want to peds. I'm just tuning in for the heck of it. No, look, give it a try, and don't let your inexperience with children make you not become a pediatrician if it's what you love. Because if it is, you will enjoy your job. That's what I have to say.
That's great. Great advice. That's wonderful. To go into the field and to prepare as a medical student, are way electives in pediatrics necessary?
That really would depend on your interest if you are a person who's very interested in a specific geographic location, and you're like, you know what, this is where I want to be for whatever reason, then I think in a way elective is an excellent thing to do. I know people who were like, I want to be at this children's hospital because I want to be a HEMOC doctor, and this is where I grew up, and this is where I got, some are even like, this is where I got my cancer treated when I was a kid. And and so they did an away rotation, and I really think the fact that they did that away rotation along with a whole lot of other stuff is why they were able to match there. So do I think if that's the case, I think that an away rotation is necessary. But I will tell you, and I'm speaking for currently, I'm going to be very honest about this. Currently, if you are interested in pediatrics and for some reason you don't get an away rotation, you will probably match. I have to, we had a lot of spots empty in our country nationwide. We filled here at WMed, but I think there were over 250 spots in pediatric programs that didn't fill across the country. So I just want, for those of you who are like, oh, my away rotation, whatever, just keep in mind, you'll be okay. You'll get to be a pediatrician. Things change, but as of right now, the matching in pediatrics looks very good for students, which is wonderful.
That's great. That's good to know. And how important is research or scholarly productivity for matching into peds?
I think that you want to match your interests. So remember how I said in the beginning, advocacy of some kind? So advocacy for kids comes in many different ways. For some people, it's writing and researching. For some people, it's being really involved with community activities. It really, I don't know that one of those, I don't know if there's one of those that, like, if you have tons of experience with lots of work that's clearly quality in either of those directions, people are going to look at your residency application and say, look at what this person, they're about advocating for kids. It'll be clear, and so those applications definitely are placed higher. Okay. Mm-hmm. I think you want to match yourself with what you do. So if you are a person who really adores research, do research and then have it on your application and put it in your personal statement and apply to a place that has that type of pediatric research available and make that match for yourself. If you're a person who's really interested in, I don't know, like I told you, I worked in the Yakima Nation. If you're really interested in rural health and improving people who don't have access to pediatricians, there's so many places in our country that have no pediatricians, and that's your passion, work on that during medical school. Have that in your application. Apply to the residency programs like that, and you will probably get in. Yeah. So I think so important in terms of matching your interests. Did I answer that?
Oh, yeah. No, you did. You did.
Okay.
is there anything else that you would
Can I say one
recommend?
more thing
Oh, yeah, go
about
ahead.
that? I
Yep.
don't know that if you saw a blank application with nothing, with no research, no community service, I have never seen one. And somebody else screens the ones that I look at as people to be interviewed. Okay.
Hmm.
So they may exist. But oh my, medical students, don't you, your application, if you have nothing on there, like I've never seen one. So I wouldn't recommend that. Not a
Yeah,
wise plan.
great. Is there anything that you would recommend to a student what they should do or could do to be a competitive applicant?
Yeah, absolutely. Um, every place in our country has a gazillion different ways to interact with children during medical school. Some of them will be set up by the medical school ahead of time. Some of them exist, some of them you can create. For example, I had some wonderful students who were working at a shelter in the area, and they were like, we noticed there's kids in this shelter. We're focusing on the adults, but there's these like kids. And then the shelter people said, hey, can you help us with these kids? So those students came to me and said, I would like to do something to help these kids that are spending the night in the shelter. What can we do? That's something they created. Now that now exists for other students to do as well. It can be something simple as mentoring. That's something that's wonderful to do as well. Those type of programs you can create or they exist. If you have an interest in working in incredibly low resource settings. I have had students walk into my office and say, Dr. Woodhams, I am interested in helping. I'm serious about this. Women and children in rural India. Can you help me develop an elective? I was like, sure. So now we have an elective and it's created by medical students. So I think looking at what exists, but not letting what exists limit you. And same with research projects. I have had students join me on research projects. I have students create research projects and they're like, hey, can you be the faculty advisor for this? And I'm sure, so think of it both ways. Think of it as you can look and see what your medical school offers, but on the flip side, look out there for things that maybe could be looked into and researched, and then just look at in reverse for a faculty advisor that probably say yes. And same thing with things that you can do for kids in the community.
Great. Thank you. Thank you for that. I kind of want to end this section by asking you, is there any resources, website or whatever organizations that you would recommend for students to learn more about the specialty of pediatrics?
Yeah, I mean, I'm going to say the traditional ones and then some that will just make people laugh. So definitely aap.org and then put in there to read about it. I think that is going to be an incredibly rich source for information. And then do the Dr. Oh my gosh, I wanted his name. Got Dr. Fleck, Dr. Flecken. What's his name?
Yeah,
Glaucoma Flecken.
Yeah, glaucoma Flecken, yes.
So when those ones focused on pediatrics come up, we play them all the time. And I got to tell you, they're spot on. So if you want a little sarcasm added into the bit, watch him. And then if you want the stuff that's a little bit more serious, go to aap.org. I mean, it's pretty basic, but I think that covers both ends.
Great. And we'll be sure to add that in the show notes as well.
Okay, I hope it's okay. I give a plug to him. He's just funny. And he is it spot on.
Yeah. No, he's hilarious. So I'm gonna now transition to the third part, which is the last part, which is giving advice for long-term career planning, irrespective of your specialty. And my first question is, if you could go back and do it all over again, what would you do differently, and what would you do the same, and why?
Yeah, I had to think about this one a lot. So if I could go back and do things differently, I think, so first I'll say my approach to medical school really was to just try to learn as much as I could and get as much out of it as I could. But so I wouldn't change that. But what I would do is while I was doing that, I don't know that I took as much joy in it because I didn't think in my own silly head that a lot of what I was learning I would actually need to use. Okay. And I think it's incredibly, like, I wish I could, I mean, this sounds like maybe personal torture, but I really kind of wish I could go back and take some of my classes from first and second year again, knowing now how they would relate better, and kind of soak up some of that knowledge. Because, so I think if I were to go back, instead of, I worked really hard, but instead of approaching it as working really hard and then in the back of my mind going, oh my gosh, like that, I might have just said in the back of my mind, maybe I'll use this someday. And it's just that simple. I might have enjoyed my study hours more. But I also think if you approach learning with, I know this from educational research, if you approach learning with that attitude, also the likelihood that you'll be able to use that knowledge later on in a meaningful way will increase. So I would say it for that too. But so if I could go back, I would definitely approach some of my basic science that I didn't think would relate differently, with a better attitude. I worked hard, but I don't know that I internally was, thinking, oh, this is, might apply. And that was one part of your question. And what was your other part? What would I do the same?
What would you do the same and why?
Yeah. I had a lot of experience in my mind of, I don't know, maybe it was from teaching kids for a couple of years, but I really approached medical school as an absolute treat. Like, I just felt so lucky that I was there and I had this chance to learn this stuff. And I loved the medical school offers so many different ways. Like, I was interested in peds. I didn't know I was interested in peds, but it's pretty clear when I look back and see what I picked to do. But there's all this stuff when you're part of a medical school that you can do. Like, there was stuff for me to, like, go to the school and teach them about STIs, or I could go to this school and teach about substance use disorders, or, all this different stuff that you can do in medical school. And I did it with some friends who did not go into pediatrics. They went into things like, I don't know, I remember one's a surgeon, one's a cardiologist. But anyway, I think that going back, I would definitely do those extra things again, because I think they reinvigorated me for class maybe a bit more. And choose things that are extra that you love. Now, I'm telling you what I did and I loved it. But if you are a person who adores research, put some research in your life. Whatever gives you that extra oomph that you're interacting with the world more, I think will help you through your first and second years. And then it's a double bonus because I did it because I enjoyed it. But then all of a sudden I have this application for residency that I didn't mean to create purposefully, but I did. And it was a great application in the end. So those are kind of a double bonus of, like, reinvigorating you and feeling like you're contributing to the world in general instead of just studying. And also they're really good for your application. So I think I would have done that the same. And also, I really had a lot of great friends in medical school, and they're just fabulous people. And I'm just really glad I took the time to enjoy my friends in medical school as well. I mean, I got to admit, I did. I did so with my friends. And I think I would keep that there. I wouldn't eliminate that by any. I just, you meet some great people in medical school, and it's great to hang out with them.
No, that's true. That's true. What is one thing that you've seen another physician do well that has made you want to emulate it? To the contrary, what is the career mistake that you've seen another physician make?
I think there is an amazing person. Like, when you think of people that you're just like, how, wow. So there's a physician named Paul Farmer. If you read up on him, it's just really amazing. And I think, this is directed towards medical students. And while you're reading about Paul Farmer, I would actually go back and think and focus on what he and his friends, because it's not just him, he's just the name that will be easier to find. Anyway, I have to pick one. So I would pick him. But anyway, him and his friends in medical school did so many out of the box, great things to improve humanity at an early time. And then they continued that, and they really continued to be well grounded and helping people. That's what they were. They were about helping people. And I just really admire his dedication to being all about helping people in just such a positive way. I mean, when you watch videos with him, it's hard to not watch an interview and not go away smiling, and that's what he's like when, once I got to eat lunch with him, I felt like I was eating lunch with Bono. But I mean, he's just like easy to eat lunch with. He's just a nice person to be around. But anyway, I would say like that would be a person who I just look at and I think I won't even come close, but I can pay attention to what I like about him and try to integrate that more in the way I approach my work. And then people who I see maybe struggle, I think that the people who struggle the most are the ones that maybe don't see the joy in their work and helping people. And so that would be it. I think those are the ones who struggle the most internally. The ones who frustrate me in pediatrics, I'll be honest, are ones who maybe are kind of lazy with the way they think, even though they're all really smart, and that bugs me. But because, nice doctors don't necessarily equal a good doctor. And it's hard to tell the difference when you're a parent. But I guess, so that kind of bugs me in a way. But I think for the ones who face most internal problems, it would be the ones who aren't just stopping and looking and taking the joy out of the work that we're privileged to do. We are incredibly lucky that we have a job to help people. That's what it is for all medicine. So yeah, that's what I would say. Did I answer that one as well?
Yeah, no, that was great. No, that was wonderful. What would be like one thing that you're struggling with or lamenting about your career today, and what are you doing to remedy it? And what would you encourage a medical student to do right now to help avoid this problem entirely later in their career?
I don't know that this is a struggle, but I can say it, and then maybe it'll help somebody in some way. I focus on education and on patient care. And that's what I focus on. I haven't focused on publishing things because frankly, I wasn't encouraged. My residency program, and then when I worked afterwards for University of Michigan, that's just not the way they function. But I think that you might find yourself in an academic situation where you have to have like publications on your resume in order to be promoted. It doesn't affect me because I don't know that I think that way. I don't know. Like I said, I take joy from teaching and taking care of kids. I don't take a joy in a label I have, but I do think that some people do, and that maybe, it might be nice to have more CME money. So if I had more publications, I could get promoted. But I guess that is something that maybe, I'm long into my career. I'm like 25 years in. So I just, it's not what I do, not because I don't value that stuff. It's not how I spend my time, So I think that's something maybe to get out there about myself personally. But again, I don't know that it bugs me too much.
Okay.
Yeah. Did I answer that one?
Oh yeah, no, that's a great answer, and thank you. I'd like to end by asking my guest, what is one book, medical or non-medical, that you think every person pursuing a career in medicine should read?
I hope this is okay. I would definitely watch the documentary, Bending the Arc. Okay. There's many books that the people on there have written, but the Bending the Arc comes from this phrase: the arc of the moral universe is long, but it bends towards justice. And it's like the group of people I was talking about earlier who I try to emulate, like Paul Farmer is one of the people in that film. It's a short documentary, and I'd rather recommend that over a book because I think it's more realistic that people might just pop it in sometime when they're, I don't know, bored, and watch it. And I think while you're watching it, notice how much good people can do when they focus on that and how much how much is possible. Because I think some of medicine is realizing the possible, whether or not you're whatever it is you're going to. If you're not in a mindset to imagine what's possible, whatever is possible won't happen. And what I like about that film is it's just crazy what happened. And so I think, maybe you're going to be one of those people who's developing a medical device. Cool. Yay.
Yeah.
And so I think if you watch that video, you might walk away from it going, I should give my idea a try for the greater good. And I think those are the doctors that push medicine forward for us all. And so that is why I like that. So again, if you may not be interested in whatever medicine that those doctors are, but anybody watch that and just think something might be possible that I'm thinking of. So that's what I would like to recommend. I hope that's okay.
Oh yeah. And
Okay.
we'll make sure we have a link to that
Okay, great.
in our show notes. Dr. Woodhams, is there anything that you think that we haven't discussed about the field of pediatrics that you want to make sure our listeners know?
I think we did a great job. I think remember that just because kids are little doesn't mean it's a big deal to take care of kids. And I think sometimes people maybe trivialize pediatrics a little bit because we're dealing with kids, but it's a challenge. So keep that in mind. I want to emphasize that those of you out there who are interested in a challenge, you will find a place in pediatrics, because I'm sometimes not sure that comes across, because we're all we tend to be a little bit of a happy bunch, but with a happy bunch does not mean that we're not interested in a challenge. So that's what I would like to say.
Yeah. Well, no, thank you. Dr. Woodhams, it's been a pleasure, having you as a guest on the WMed Specialty Spotlight. For everyone listening, we'll wrap up the show with that. I hope you enjoyed the conversation with Dr. Woodhams. You can find the resources and additional insights mentioned in this episode in the show notes on the WMed website, wmed.edu/specialty spotlight. If you found the episode helpful, please consider sharing it with your fellow medical students, especially those who may be feeling uncertain about their career paths. My goal is that these discussions with experienced physicians will inspire and guide you and navigate your own career decisions. If you have any questions, don't hesitate to reach out to the career development team at career.development@wmed.edu. Until next time, take care.